Hi, everybody. Mary Ferguson-Perret here. And thanks for joining us today for MFP TV on location. We're at the Anthony Fell Boardroom here. And I'm here with three really key leaders who are working together with myself and all of you to do better in hand washing and hand hygiene at UHN. And what I mean by that is that every time that we need to, and we'll hear more exactly about what that means, 4 points in time possibly, that we're washing our hands and not endangering our patients and their families in terms of infection. And so we want to talk about this to you and want you to know that we've got a big launch going on and what you might expect to be seeing over the next couple weeks. So I want to begin by talking with Emily Musing, who is leading for us in patient safety here as our patient safety officer at UHN. And Emily, can you say a bit about the importance of this for the organization for patient safety?
Certainly, Mary. So I think from a patient safety perspective, hand hygiene and prevention of nosocomial infections is probably the biggest priority for UHN. We became interested and aware of this with all the provincial reporting, the required reporting that we have to do with regards to how well we're doing with hand hygiene and our various nosocomial infections. We're now able to compare ourselves to other hospitals, and frankly, we're not happy with the results. We think we can do better than what we're doing. We have a balanced scorecard target currently of 50% at hand hygiene compliance, and we're barely meeting that. And as of next year, we're moving towards 70% target, and I think we need to work hard to really get to that end.
Mm-hmm. And I'm going to put the challenge, we need 100% hand washing. Yeah. We don't say 70% and 30% of the time, don't bother. It's 100% of the time that we are trying to get to. Would you say, Emily?
I think that's a fantastic goal to have, and I think that's a goal that everyone should have.
Now, we formed, and Judith is a co-chair of a special committee here called the Committee for the Elimination of Healthcare, or is it hospital-acquired infections.
That's right.
And Judith, this is you're key leader in this with our IPAC colleagues. Can you speak a bit about the launch?
Well, this is extremely important to our patients that we care for every single day, the many hands that touch patients every single day. Nursing is there at the forefront, and we're committed. Certainly at the Committee for the Elimination of Hospital-Associated Infections, we have many very strong nurse leaders around that table who are there to help us, inform us, help to identify, and all of you out there know in terms of identifying incidents, helping us to identify where the gaps are in our system so that we can plan and prevent hospital-associated infection. So it's critical, and our professional nursing practice council is very energized around this theme as well. So we're all on board for this launch.
And I think also that CHI, as you call it, is an interprofessional group and an interdepartmental group as well, and that we have lots of involvement from all of the disciplines, pharmacy, everybody. Okay. This is everybody's business. It's about every discipline, every department, right, Judith?
It's a very well-rounded committee, and it is everybody's business. We're here not for ourselves. We are here for the patients and families that we serve.
And we also have with us our IPAC colleague and leader, and we want to know, and of course these guys are in the fray every day, helping us to do better every day, everywhere, and just thanks so much for that. And we're going to now go out in the week of July 5th and launch a hand hygiene initiative here where we want to get everybody on board, every discipline, every team, every unit, everywhere, doing 100% compliance, I'm saying. So tell us about this, Karen, the launch and how it's going to go.
Well, we're very excited. It starts July 5th. We're going to be having leaders from all three sites go about the hospital facilities floor by floor on the inpatient units. And we're going to be talking about how important this is to us and talking about the goals that Emily mentioned previously. To date, we've had auditors on the floor collecting information about the 4 moments that you mentioned before, which is before patient contact, after patient contact, before sterile technique, and after contact with body fluids. But the moments that we're going to be reporting on specifically and that we're going to be using as our balanced scorecard goal is the before moment. That's the one that we're really emphasizing because it's the one right before you touch the patient. So that's what we're going to be rolling out. We're going to be meeting and talking about this with all of the different frontline staff, talking about the importance, and we're going to, encourage them to call their peers upon doing better hand hygiene practices and actually offer a big poster. And we're also displaying a whole bunch of different things in the UHN news over the upcoming months to talk about the launch, and we're going to keep revisiting this with everybody because it is something that we really need to target as a goal within UHN.
And so there's going to be a big poster with a big hand on it, and it's going to show the performance level for each unit.
That's right.
And initially, it's going to be available for the team on the unit to see, but subsequently, it's going to be posted for the public. Is that correct?
That's right. So at the very beginning of the launch, we're going to encourage the units to put this poster within the staff lounge or in a private area where they can monitor it within themselves and get comfortable with the information. They can talk about the data, and if they have questions, get in touch with any one of us or their leaders. After that, we're going to encourage people to put that data out on the floor so the patients can see it, so they know that it's that important to us. So I think we're going to have to prepare everybody to be ready for those questions and make a better effort to improve hand hygiene.
So I'm just really excited about this, also nervous. It's a little scary, sort of putting out our performance, which is not perfect. But it's wonderful that we're doing this, and we're just taking this and we're going to wrestle this issue to the ground. And I want to thank all three of you, and I want to thank every one of you for helping us to lead for this and helping it to happen 100% of the time, that we're going to protect our patients and that we will not be causing any untoward situations due to infection or God forbid, any deaths due to infection at UHN. So thank you for being with us. Thank you for leading this, you guys. And thank each of you for being leaders from where you stand. Talk to you later. Bye-bye.